Good morning. Today lecture about the second part of mandibular implant supported over denture by master students Ruyaa Mohamad in prosthodontic dental technology under supervision of Dr. Saja Muhsin, College of Health and Medical Technology, Middle Technical University. I will presenting you about overdenture option 3 and overdenture option 4 and overdenture option 5 in this lecture. In overdenture option 3, three root form implants are placed in the A, C and E position as shown in the pictures. Then, three implants are connected by superstructure bar, but with no distal cantilever. In overdenture option 3, there are two types of fabrication procedures are explained. The first type, making final impression with a custom open tray. After repair the impression, the implant abutment for screw analogs are attached to the direct impression transfer coping, then reattached to the cast. Continued the procedures by making the base plates on the cast with incorporating the direct impression transfer coping. Also making wax rim that attached to the base plate and record the occlusal vertical dimension and the bite registration that is used to mount the maxillary and mandibular wax rim. Setting of artificial teeth in a conventional method. Then the trial denture is ready to confirm the aesthetic and occlusion and the positions of the teeth for retention. In the patient mouth, the implant over denture contours was made and the connecting bar and the attachments are positioned within the denture contours and away from the denture teeth. After that completion, the bar and over denture are implant over denture are delivered to the patient. Second method for fabrication over denture option 3. Primary impression made with irreversible hydrocolloid material. For an accurate master impression, the implant analogs are splinted with autopolymerized acrylic resin. Then, custom tray was fabricated with occlusal window openings to allow individual access to each impression coping. When the resin reached the final setting, making impression with light body material. After set the impression material in patient mouth, the guide pin were loosened and the impression was removed from the patient mouth and returned the implant analogs to the impression, then poured with the dye stone. As a conventional method, making the record base with autopolymerized acrylic resin and record the jaw relation with manipulating the patient's mandible into the centric relation position. After that, the maxillary and mandibular cast was mounted on the Hano articulator with the face board transfers, then teeth arranged and tried in patient mouth to evaluate aesthetic and phonetic and vertical dimension of occlusion. In other hand, fabricate the occlusal silicone tooth position index, incorporating the incisal edge and the occlusal half of the mandibular denture teeth. Then the occlusal silicone index was cut exactly in the center by joining incisal edge and the central grooves of molars. The benefits of the silicone tooth position index may be used during bar fabrication procedures to facilitate accurate repositioning of the denture teeth in relation to the master cast. Bar fabrication. Castable bar are waxed and attached to the abutments, and sprucing was done, then invested and casted to get metal substructure. When the bar was finished and polished, there is checked in the patient's mouth for passive fit. After the verification of the passive fit, the overdenture was fabricated. The overdenture fabrication was done by placing the finished bar with positional clips and metal housing on articulated master cast. The anterior teeth removed and window was made in record base to provide space for bar assembly. Then tooth position index was used to place the teeth in the same location. When the bar was placed on master cast, the undercut surface area was blocked and making the duplication with rubber-based impression material, then cured the impression with dental stone. On final cast, positioner clips were placed along with the metal superstructure, and the undercut surface area of metal superstructure was blocked with the type 3 gypsum product to avoid flow of resin between positional clips and bar. Then the complete denture was processed by conventional technique. The complete prosthesis consists of metal superstructure that incorporated incomplete denture, and positional clips are discarded and replaced with medium retention clips. After finished bar was placed in patient mouth and the abutment screwed down to 32 Newton on centimeter according to manufacturer instruction. After fixation of the bar in patient mouth, the denture was checked for proper extension. And the home care instruction were discussed with the patient and then trained for insertion and removal of the new denture. Overdenture option 4. 4 implants are placed in the A, B, D, and E positions as shown in the picture. These implants usually provide sufficient support to include a distal cantilever up to 10 mm on each side when the stress factor are intermediate to low. Prosthodontic technique for fabrication over denture option 4. After wax trial denture is placed and evaluated for aesthetic, phonetic, occlusal, vertical dimension, and centric relation in patient mouth, the locator abutment and metal housing is placed on implant analog on the master cast. The black dots area indicates the framework support truss will contact to the cast land area. Then design the framework and mark it on the cast. Note that the locator housing are relieved to indicate available space that must be accounted for the design. Then making the transparent matrix of CMOS surface contours that permits visualization of the restorative space defined by the planned implant supported over denture, and aid the technician in the framework design and fabrication. Then the framework was waxed up on the relieved and blocked out refractory cast. Pattern framework waxed and invested and casted, then finished and polished. The metal framework with support struts extent may be placed on the cast land area. After checking the metal framework on the cast, the denture tooth silicone matrix is made and trimmed to accommodate metal support struts so that it is completely set on the cast land area. Then setting the artificial teeth on the metal framework as a conventional method. Then final overdenture waxed up and encapsulating metal framework prior to investing and processing procedure. Then the framework secured in the flask drag with dental stone investment. They complete the flasking as a conventional method and make finishing and polishing the final denture. After completion the procedure, the overdenture is placed and adjusted in patient mouth. Normal recall evaluation are scheduled and the patient exacted the cut surface of the support struts remain visible through CMOS surface since they impose no aesthetic. Overdenture option 5. 5 implants are placed in the A, B, C, D, and E positions as shown in the picture. The superstructure is usually cantilevered distally up to 2 times of the AP spread as shown. If almost of the stress factor are low, the average of the cantilever is about 50 mm, which is placed under the first molar area. Fabrication procedures for overdenture option 5. In this option, there are several clinical visits for patient and many laboratory steps. In first appointment, abutment selection was done. The procedures labeled by removing the premucosal extension and selecting the abutments for sucral retention, then placed it into the implant body. We remember the abutments for sucral platform usually is placed 2 mm above the tissue in the mandible to facilitate daily home care. Then placing the indirect impression transfers into the abutments for sucral retention and making impression with irreversible hydrocolloid or addition silicone for indirect impression transfers and surrounding tissue by syringing the impression material around the implants and tissues to facilitate the recording of these transfers. After removing impression from patient mouth, hygiene cover screws are placed over abutments to protect the threads from calculus and debris. Then the impression shipped to the laboratory to design the custom tray accurately. The second prosthetic appointment is scheduled to 1 to 2 weeks after the first appointment. The laboratory first phase. In the first laboratory step, The costume tray was fabricated. After puring the impression with the dental stone, indirect impression transfers are replaced with the direct impression transfer, with placing long fixation screw on the working cast. About 1 millimeter thickness of wax relief is placed over the tissue region of residual ridge to be captured in the impression and making tissue stops on the molar area. The impression transverse coping are exposed about 3 millimeter to allow fixation of screw, then lubricating the cast and wax lightly with petroleum jelly to prevent wax from attaching to the tray. After that, fabricate custom open acrylic tray on the working cast and trim the border of the tray about 1 to 2 mm as a complete denture custom tray. Then widening the holes of fixation screw to allow easy insertion and removal from the cast. Second appointment, final impression is made. In this step, tightening the direct impression transfer coping and fixation screw in the final abutments for screw retention with moderate hand pressure. The custom tray is seated intraorally to check the adequate space for impression material. After checking, painting the internal surface and borders of the tray with the tray adhesive. Then injecting the impression material, either addition silicone or polyether, around the implant and into the tray. Then seating the tray in the patient's mouth. After that, trim any excess from the hole around the screw of the material. When the impression material are completely setting, the fixation screw are unthreaded and pulled several millimeters to check that they disengaged from abutments for screw retention. Finally, impression and transfer copings are removed from the mouth and evaluated. Then, abutment for screw retention analog is threaded carefully onto the direct impression transfer coping in the impression. Then the impression sent to the laboratory for the second steps. Laboratory second phase. In this step, trimming the impression and boxed with the plaster, then pure the impression with the two steps technique by dental stone. After the stone has set completely, remove the long screw from the direct impression transfers and the impression is taken off from the master cast. Then the impression transfer coping are secured into the position on the master cast that will be used in the fabrication of the denture. Then lubricate the master cast lightly with petroleum jelly. Then make record base either from cold cure acrylic or light cure acrylic as a conventional method. After set, trimming the borders of the tray, then finishing and polishing it. After completed making of the record base, then make the wax rim that attached to the record base. The rims is adjusted to about 20 mm from the occlusal plane to the vestibule in the labial frenum area, and in the The posterior parts of the rim is adjusted to 2/3 up to height of the of the retromolar pad area. Also making the open in the wax for distal fixation screw on each side of the arch. After completed, the record base with bathroom is sent to the clinic for the another appointment. Third appointment. In this step, verify the fit of base plate to the intraoral abutment for screw retention, and then adjust the vertical dimension of occlusion in centric relation and recorded it. Then determine the maxillomandibular relationship. After that, the next appointment is scheduled for 1 week later. Then the recorded rims are sent to the laboratory to complete another steps. In the laboratory, mount the master cast with the occlusal record on the articulator, then setting the anterior artificial teeth for aesthetic, phonetic, and function, and also for lip support. The incisal guidance should be flat for the aesthetic. And remember, during the laboratory steps, the anterior teeth are modified as required, and posterior teeth are set in the medial position lingualized occlusion for giving maximum retention and stability. Fourth appointment. In this step, evaluating the teeth setup intraorally for aesthetic, phonetic, and lip support, and verified the occlusion in centric relation. Then the trial denture is removed from the patient's mouth and hygiene covers are reinserted into the abutment. Also, the next appointment is scheduled in 1 to 2 weeks. This is scheduled depending on the laboratory schedule. Laboratory fourth phase, fabricating the fifth appointment. In this appointment, evaluate the casting bar in the mouth and verify passive accurate fits of the bar in the mouth. Then place the casting bar initially and evaluate it for stability. Only the central screw is inserted partially initially when multiple abutments are present, and the prosthetic screw are threaded into the bar and abutment, starting with the C implant, then the B and D implant, and then E and A implant. After completing the screwing of the implants, the connecting bar should have no pain upon insertion. Finally, insert the overdenture in the patient's mouth, and the occlusion is evaluated and modified as required for bilateral balance. And the final prostheses are delivered. Before ending this lecture, finally, I will explain you about angulated abutment supported mandibular overdenture. In this case, show severe anterior inclination for healing cups with gingival inflammation. Many questions in your mind: how to correct this problem? To solve this problem or defect, done by the steps as I mentioned them. Already making impression with open tray using medium and light body and light body polyvinyl siloxane impression material, then pure the impression with type 4 stone. Placement of long impression post-pin into the analog that have severe anterior inclination of both implants. Remember, the angulation was approximately 55 degrees from a line perpendicular to the ridge. And fabricate the matrix to covering the entire denture and sectioned the matrix vertically over the sides of both implants to evaluate the space available. Then the cast to locator was waxed to the cast and to gold abutment and using surveyor to ensure the parallelism. After waxing and investing as a conventional method, the implants are casted with the type 4 gold, then finished and polished. After correcting the angulation of abutments in the laboratory, then sent to clinic, the dentist were inserted and torqued to 20 Newton on centimeter. Also, inserting the locator cup with the black processing mill into each locator implant abutment, leaving the white block out spacer beneath. The gingival tissue responded well to the corrected angulation and appears healthy with approximately 1 millimeter of attached mucosa on the facial surface as shown in the picture. The occlusal view of mandibular denture in place and this final picture shows the facial view of the denture in full occlusion after treating the angulation of the abutment. The lecture ends and will be continued with the third part of the maxillary implant supported over denture next week. Thank you very much for listening.